Good day everyone. This is our case presentation. Case title is Peptic Ulcer Disease. Presenters Lamsan Justin Louis C. and Dishar Jillian Carla. And our case is a 23 years old male visited clinic with complaints of an upper abdominal pain, heartburn, and sometimes vomiting. He was in usual state of health 5 days back when he started having a big gastric pain aggravated at night after taking large meal. He was fond of fried and spicy food. He had a family history of peptic ulcer disease. He denied cigarette smoking. And this is the pathophysiology of the disease. And you can see this here in the normal and the injuries, defensive forces like that. And we have here the SOAP analysis or information gathered to the patients. Age is 23 years old, sex male, economic status is BPO employee, height is 5'8", and his weight is 58 kilograms. Patient history. Past medical history is none. Social history is never smoked tobacco. Yung alcohol is 1 drink per week siya. And based on the review of the system is he reported that he is experiencing progressive upper abdominal pain, heartburn, and sometimes vomiting. Medication history, he was using Synflex or naproxen to relieve pain from past 2 days but no significant effect. Then he decided to consult doctor. In allergies naman, no allergies have been detected in the patient. And the subjective information symptoms is he reported that he is experiencing progressive upper abdominal pain, heartburn, and sometimes vomiting. And he also admitted to having pain aggravated at night after taking large meal. He denied cigarette smoking. He also said that he had a family history of peptic ulcer disease. He was fond of fried and spicy food. And here's the objective information or symptoms of the patient. A 23-year-old male who appears having a pain every night after eating his meals, although abdominal pain, heartburn, and sometimes vomiting are complaints. They are not ongoing during this evaluation. The BMI of the patient is 19.44 kilograms or M2, and temperature is 98 degrees Fahrenheit. BP is 120/70. And here's the patient assessment. The wrong drugs and needs additional drug therapy. In the Synflex or naproxen one is no significant effect. And here's the explanation about Synflex is the use of this medicine is severe effects are indigestion, heartburn, pains in your stomach, feeling or being sick, or diarrhea. This can be a sign of an ulcer or swelling inflammation in your stomach or gut. Primary impression: his medication does not react to him. It is concluded that omeprazole is highly effective in healing refractory peptic ulcers. It's best to avoid alcohol if possible, although it does not affect the way omeprazole works. Alcohol makes your stomach produce more acid than normal. This can irritate your stomach lining and make your symptoms worse. And the clinical guidelines we used here in our case is the clinical practice guideline of the diagnosis and management of peptic ulcer. Mini review with respect to case. And here are the evaluations. Number 1 is the scope and purposes. And maximum possible score namin is 42 and minimum possible score is 6. And here is stakeholder involvement. 42 in maximum and minimum is 6. And the domain 3, the rigor of development, maximum is 112, minimum is 16. In the main 4, clarity of presentation, maximum is 42 and minimum possible is 6. Domain 5, the applicability. We have here the guidelines describe facilitators and barriers to its application. The guidelines provides advice and or tools on how the recommendation can be put into practice. The potential resource implication of applying the recommendations have been considered. And the guidelines presents monitoring and our auditing criteria. We have here the maximum possible score is 56 and minimum possible score is 8. Here in domain 6 is the editorial independence. Number 22 is the views of the funding body have not influenced the content of the guidelines. 23 competing interests of guidelines development group members have been recorded and addressed. Maximum is 28, minimum score is 4. And our overall guideline assessment is number 1, the overall quality of this guideline is 7. This is the highest possible quality. And number 2, I would recommend this guideline for use is yes with modifications. And these are the list of patient symptoms with treatment goals. When he experiencing heartburn, goal of treatment of this is relief of symptoms, prevention of symptom relapse, healing of erosive esophagitis, and prevention of complication of esophagitis. With feeling vomiting or nausea to prevent vomiting and minimize. And upper abdominal pain naman is the goal of the treatment of this is relieving the symptoms of upper abdominal pain. Plan or list of possible solutions. We have pharmacists made 3 types of intervention after reviewing the patient history and physician prescription. These include drug-related interventions, dietary modification, lifestyle modifications. And so we have here the drug-related interventions. A is take omeprazole before a meal. And letter B is there is no need of ranitidine, H2 receptor antagonist at this stage of patient. Triple drug therapy is followed in the patient as PPIs and mucin syrup is already added in medication to relieve burning sensation. And here in the dietary modification is number 1 is omega-3 polyunsaturated fatty acids should be added as they have an anti-inflammatory effect and protect stomach from ulcers. B. Avoid spicy food. C. Avoid late night meals. Letter D is take healthy balanced diet having low cholesterol. Letter E is take plenty of water and fresh juices. In lifestyle modifications naman, is 1 is avoid lying down in bed immediately after a meal. 2. Elevate head of bed. 3. Avoid stress. Here is the rationale for recommendation. The brand of the medicine is the amoxil. The generic of this is amoxicillin. Strength to be used is 1 grams, and here's the frequency. And clarithromycin, generic is clarithromycin. Strength 250 milligrams. Frequency. Resec or omeprazole in generic 40 milligrams strength and the frequency. Lamed ranitidine in generic and strength is 150 milligrams. Mucin suspension or the generic name is aluminum hydroxide, magnesium hydroxide or oxetazine 120 ml, and here's the frequency. There's already therapy-specific variables. Medication, name of the drug is omeprazole. Dosage form is delayed release oral capsule. And dose and dosing interval of omeprazole is 40 milligrams. Duration of therapy of this is 40 milligrams once a day for 4 to 8 weeks. Expected outcome and when will this outcome be reached is, however, the primary adverse effect reported in drug labeling include headache as 6.9%, abdominal pain as 5.2%, diarrhea as 3.7%, nausea is 4.0%, vomiting is 3.2%, and flatulence is 2.7% in adults. Omeprazole starts to work within 2 to 3 days, but it may take up to 4 weeks for it to work fully. These are the list of possible side effects or adverse effects of the medicine. The number 1 is the headaches, feeling sick, being sick or diarrhea, stomach pain, constipation, and farting flatulence. Signs that the treatment is not working is you should start to feel better within 2 to 3 days, but it may take up to 4 weeks for omeprazole to work fully. You may still have some symptoms during this time. If you treated yourself with omeprazole that you bought from a pharmacy and your symptoms are no better after 2 weeks, tell your doctor. And price of the omeprazole per capsule is 39 pesos 0.75. Counseling points is take omeprazole capsule or delayed release capsules before a meal, and preferably in the morning. Omeprazole tablets may be taken with food or an empty stomach. Take omeprazole powder for oral suspension on an empty stomach at least 1 hour before a meal. And also the patient should always monitored for these signs and symptoms when taking omeprazole. Complementary medications is the name of the products are the amoxicillin, clarithromycin, and aluminum hydroxide. Clarithromycin and aluminum hydroxide, magnesium hydroxide, and oxytocin. And the dosage form of the amoxicillin is capsule. The clarithromycin is also capsule. And the aluminum hydroxide, magnesium hydroxide, or oxytocin is antacids. And here are the dosing interval or how to administer the drugs. The amoxicillin is 1 grams. And here is the frequency of this, and the clarithromycin is 250 milligrams, the frequency also. And the aluminum hydroxide, magnesium hydroxide, oxytocin is 120 ml, 1 tablespoon, and here is the frequency. And the duration of therapy is 1 to 2 weeks or in days 7 to 14. And here's the most common causes of the peptic ulcers are infections with the bacterium Helicobacter pylori or H. pylori, and long-term use of non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen, Advil, Motrin 1B, or others. And naproxen sodium like the Aleve or stress and spicy foods do not cause peptic ulcers. And here is about the drug interactions. Clarithromycins can cause an irregular heart rhythm that may be serious and potentially life-threatening. Although it is a relatively rare side effect, the risk is increased if you have low blood levels of magnesium or potassium, which can occur with bowel cleansing preparations or excessive use of medications that have a laxative effect. Do not exceed the dose and duration of use of magnesium hydroxide recommended on the product label or prescribed by your doctor. You should seek immediate medical attention if you develop sudden dizziness, lightheadedness, fainting, shortness of breath, or heart palpitations during treatment with these medications. In addition, you should let your doctor know if you experience signs and symptoms of low magnesium or potassium, blood levels such as weakness, tiredness, drowsiness, dizziness, confusion, tingling, numbness, muscle pain, cramps, or the vomiting. It is important to tell your doctor about all other medications you use, including vitamins and herbs. And do not stop using any medications without first talking to your doctor. And here is our quiz for peptic ulcer disease, and thank you everyone.